welcome back. Before we took the break, we were with President Uhuru Kenyatta, who is at the Kenya School of Government, where he's announced a number of changes to the structure of the National Police Service for what he says is to eliminate overlap in the reporting structures and assign specific and distinct functions to the Administration Police, Kenya Police, and the Directorate of Criminal Investigations. He said to be careful not to say that none of them are no longer in existence, but there's just been a restructuring. So when are you sexually active? We are moving on to another subject here. And when was the last time you were tested for HIV? To take this conversation forward and to speak on the Mwanaume Kamili Hujua Status Yake campaign is Dr. Cathy Kanari, who's the Senior HIV Manager, Population Services, Kenya. Welcome to the program, Cathy. Do you prefer Catherine or Cathy?
Any can do.
Okay, so the campaign is, if you could take us through that again?
So the campaign is basically to get more men tested and generally to increase the awareness of testing among our male population, generated mainly by conversations around health-seeking behavior of men. And we realize that health-seeking behavior of men is poorer than for women. And in essence, even if you sit at a facility or wherever testing services are available, you realize that more women get tested than men. So the campaign is just to emphasize that in as much as you have everything in check in your life, you still also need to know your HIV status, and there's no weakness about it.
Okay,
yeah.
But have you done like a survey to try and find out why more women than men are willing to get tested? Okay,
so the survey generally is the perceptions that we've gotten from the ground that mostly men do not prefer waiting in a health facility and do not want to go to a health facility to get tested. And the other thing that really scares men and scares anyway in general population is the fact that you can turn positive, and we're finding that more men are so scared of turning positive as opposed to women who somehow they find a way to cope. And mostly for women, they interact mainly a lot with the health facilities, and they're able to get these options of testing. So we realize that there's a few issues surrounding that.
Okay, but then the statistics show that generally women are harder hit than men when it comes to HIV. Yes. If we look at it, the number of adults and children living with HIV, women aged 55 and over, we have 860,000 who are living with HIV compared to 520,000 living with HIV. Could that be perhaps because maybe more women have gotten tested than men?
Yes, and you see the entry point for knowing that you're HIV positive is actually getting tested. And if we can't drive this traffic through, we can't actually find out, is this the real scenario? We do know that more women have been found to be positive than men, but is this a case of that we don't have enough traffic coming to the entry point for testing? Again, it takes two to tango because HIV spread is heterosexual, mostly, as we see it in our population. So we do know that this could be a masked figure, that there are guys we've not been able to reach. And this is why we have this campaign drive, to just tell the men, you can now go get tested. It's nothing major.
And is there a specific demographic that's at higher risk than another one?
So when we look at it in Kenya, of course, we have what we call the key populations or most at-risk populations. And these are mostly what we have as female sex workers, and then men who have sex with men, and then people who inject with drugs. So their prevalence is always higher. Again, we do say these female sex workers, their customers are the men. I mean, it takes two to tango. So they are more willing, or they are found more willing to test for their status than their clients, so to say, or their partners. So this is why they drive, because in as much as we can tell that the most at-risk population is this age demographic or this behavior demographic, we are unable to drive enough traffic for men to come in and get tested.
Okay. But in terms of outside those groups, outside the persons who are injecting drug users, who moonlight, so to speak, which other demographic should be cautious?
So I think we're looking at the men who are sexually active. I mean, sexual activity is your risk profile, and we're looking at people who are aged 18 to 54. And we know we have various social phenomenons that we have in Kenya at the moment. So when I look at it, we're looking at what we call the sponsor-sponsee phenomenon, and we are seeing that there's a lot of transgenerational sex happening. There's a lot of transactional sex happening again. So these are the people, because we know it's easier for ladies to actually get tested. We want to now emphasize and remind people you need to get tested to have your life in check.
Okay, do you see now like the sort of sluggishness when it comes to testing? Initially, there was a lot of awareness raising, so that is sort of, I don't know, it hasn't been quite in your face.
Yeah.
So do you think since then there's been sort of like a drop in the number of people getting tested?
Not necessarily a drop, but we do realize that in terms of sensitizing the general public, campaigns did go down, and it was mainly assumed that most people know about testing, most people do know their status, but we're realizing there's a generation coming up that they didn't have this when growing up in terms of being sensitized and knowing that this is a big thing and you need to get tested and all that. And then we still have the older men who are interacting with this young generation through the younger ladies. And you realize that, again, these younger ladies and these younger men, their generation didn't grow up fearing HIV the way we did. And we don't need to fear it because it's a condition that you can live with like any other. But what we are saying is we're realizing the rise in prevalence amongst our youth is higher, and we need to do something about it. So in that case, what is our entry point? Once you find you're positive, there's a medication that you take, and you can live as fine as anybody else. So we just need to get you to know your status to curb this spread.
Okay, so what you found is that men generally are not too keen on getting tested because they don't want to wait in line. Yeah. And what are the other reasons you pointed out?
Mainly the fear of turning positive. That's a major risk factor. Yeah, that's a major factor for them.
All right.
Yeah, they'd rather just not know.
So what other options are there? Say I'm a very private person and I'm shy about walking into a health center and you know, just asking for a HIV test. Yeah. What other options are there for me? So
we've come a long way in terms of testing. I remember initially when we started sensitizing people on HIV, you could only get this testing done in a facility or in the VCT centers. And sometimes that brings stigma to the person going to get tested, because everyone walking in knows that this center is for HIV testing. So we've come a very, very long way. And as at late last year, this year, we've introduced self-testing, which is whereby you can get a test from a local pharmacy, buy it and test at the privacy of your own home. And we recommend this for people who actually don't want to go wait and you're ready to know. And some people have told us that they're not willing to be cancelled. It takes a lot of their time and they're not willing to wait in line. So there's the option of self-testing. And this has been done in various countries, not only in Kenya. But right now in Kenya, it's available. There's a website that can give you this information. Maybe we'll share it during this time. And you can actually buy the test for 500 shillings and test yourself. And we do insist that once you test yourself, if it is positive, you still have to go to another facility or to a health provider to confirm that the test is actually positive.
Okay. But, you know, counseling plays a role. You know, the idea was to prepare you mentally for whichever results you get. Yes. Now, if you eliminate the counseling and there's just self-testing, isn't there a risk that somebody could get into depression and perhaps not deal with the issue productively?
That is true, and that's why we're saying even if it turns positive, you still have to go to a health provider. However, there are some people who are like, I just don't want to get cancelled. By the time I'm coming to test, I'm ready for this test, and I know, as in, I'm willing to test. So the main issue becomes now, do I want to wait in line? Do I want to be told by someone else I'm positive? Or do I want to take this a step at a time? So it's not for everybody. Again, counseling does play a very crucial role, because the aim of counseling is to prepare you. And it's to prepare you for the better or for the worse, whichever way you look at it as a human being. So we are not relegating the role of counseling. We're just saying that if this is your option, if you want to do it at home, if you want to test with your partner at home, this is an option that you do have now, as opposed to go queuing and getting the conventional way.
Okay.
Yeah.
Right. Thank you very much, Daktari. That is Dr. Cathy, who works with PSI Kenya, encouraging men, calling on Kenyan men, go out and get tested. They say particularly now we're seeing something called the sponsor-sponsee phenomenon, where older men are at risk and younger women are at risk. So if you haven't gotten tested, we'd like to hear why you haven't gotten tested. Your survey or your whatever research you did showed that men generally don't like don't like waiting or going to health centers. There's also the fear of stigma and also the fear of a positive result. So if you haven't gotten tested, perhaps if you're willing to share what would be your reason. And your campaign, there's the slogan, what is it again?
Mwanaume kamili ni kujua hali yake.
Mwanaume kamili ni kujua hali yake.